Hello and welcome back to the EMJ Gold podcast, brought to you by EMJ, your number one open access destination for HCPs and pharma globally. Jade, welcome back to another episode. How are you doing?
Much. Doing very well, thank you. It's been all systems go here at EMJ, prepping for the next quarter of the year. I do hope all our listeners are looking forward to the next coming months just as much as we are here at the business.
Absolutely. There is loads of exciting things on the horizon. But staying in the present, what do we have coming up today?
Well, I recently had the opportunity to chat with Martina Dempsey, and she is the Vice President of Commercial Strategy and Operations at Astellas. She joined me virtually for this one as she's based in Ireland, but yeah, Martina's had a really impressive career spanning leadership roles both at Astellas and GSK, with some really impactful and insightful additional expertise in global transformation and medical affairs as well.
Real full circle of experience there. She's even a board member for the Irish Pharmaceutical Healthcare Association, and not only that, a huge advocate of getting more women into the pharmaceutical industry, which is exactly the topic I believe you're going to talk about today.
Absolutely, indeed. We discussed her own journey into the industry as a woman, the role that mentorship can play for women in the industry, and what the future of pharma could look like in terms of balancing the genders at C-suite level, and much, much more.
Well, sounds great. Always a topic I find very interesting. Shall we listen in?
Yeah, let's do it.
Hi, Martina. Thank you so much for coming on the podcast today. How are you doing?
I'm doing well, Jade. Thank you very much for having me.
Wonderful, no problem at all. So yeah, we met back in last year. Was it November at Reuters? And
right.
Yeah, it was just amazing to chat to you there. And I've been gunning to get you on the podcast ever since. So thank you for finding the time to get on today.
My pleasure.
So one thing that I wanted to discuss with you, and I know that you're very much an advocate for, is female voices in the industry and how women can enter more leadership positions. So it's something you're very much an advocate for. But was there a particular moment that led you to become such a big fan of women in the pharmaceutical industry?
Not a particular moment per se. I mean, I've always been really interested in people development and, cultivating talent, pretty much irrespective of gender. I've found it really rewarding, seeing how you can magnify the impact of individuals and also kind of build and engage high-performing teams. So I was lucky enough early in my career to experience really good mentoring and coaching. I recognized the impact it could have in practice. And I kind of felt early on that it was really a primary responsibility of being a manager, understanding the backgrounds and interests of team members and, working with them to achieve their potential and trying to find that sweet spot really between personal aspirations and our business needs. So I've really always had great satisfaction from sort of working with talent and trying to develop them. And I'm always really proud, when a team member or a colleague moves on and moves up. I'm a big believer that everybody has it in them to succeed. Of course, it takes hard work, but it also takes sort of the support and visibility that is created, through networking and having good, strong networks. And it also takes a degree of confidence, to position yourself for opportunities and to remain open for them as they come. So, in terms of the female aspect, as we both know, there's absolutely no shortage of female talent who work hard. In my experience, they may not always be as well networked, and they certainly can be more reticent at putting themselves forward. So I think it's important to rectify that. So I suppose in summary, my interest in supporting women in pharma has kind of evolved from my broader interest in growing and developing talent more generally. Because I really believe that, one of the most important things a company can do is to find, support and invest in our leaders of the future. And that diversity is key. Some of the best teams I've ever worked in have been really diverse, gender, background, every sort of diversity. And I think it creates a really healthy tension and challenge, that diversity of opinion and background. And I think it delivers better outcomes. So I think we really need to strive for equality at all, gender equality at all levels of the organisation to try and enable and empower that.
Yeah, I completely agree with you there. I love the point that you touched on there about diverse voices and how that can really impact outside of the company as well. I think that's especially important working in the pharmaceutical industry, where if you don't have those diverse voices around the table, there could be specific concerns that patients are experiencing. But if no one is representing any of them around the table, then their voices won't be heard. So yeah, it's really
That's right.
encouraging to see.
That's right. Yeah, completely agree. The ultimate goal really is to strive to have the best people in the best positions to deliver the absolute best outcome, because ultimately, that delivers the best outcome for patients. So yeah, fully agree, Jade.
Absolutely. Cool. Thank you. So obviously we've touched on there that you're very interested in training everyone, no matter the gender. But moving on to my next question, it's more around the next generation of women in the industry. As we've touched on as well, there's no shortage of talent for women, but it's whether or not they're actually entering the field. How likely do you think the next generation of women are to enter the industry? And do you think there's a way that the industry can shape itself to better appeal to the next generation?
Yeah, I think the next generation of women are really highly likely to enter the industry. As we've touched on, there's no shortage of talented women, and women in STEM, and particularly, through the efforts of governments and educators, have really, helped break down any barriers that might kind of arise in terms of pharma and women, and has indeed developed an absolute wave of talented and highly engaged women who are really equipped for a career in pharma. So then the question is, how likely are they to enter pharma? And I'm a mother of two women, young women in their early 20s. So I think I have some personal insights into this. I really believe that this generation of talent are very clear-eyed about what their working life should be. And it's a bit different to certainly my experience or my expectations. But I do think the pharma sector is intrinsically aligned with many of these needs. Young people want work that has real meaning and purpose. They want their work to be aligned with their values. They want to feel they're making a positive impact. And, pharma's mission of, bringing new life-altering medicines and advancing the health of patients and societies is really one of the highest purposes there is, in my view. And I think, therefore, that, it appeals to that sense of, purpose that young people are looking for. I think they also, young people also want sort of a growth. They have big growth mindsets, and they want a career that affords opportunities for continuous learning and professional development, and probably career evolution. Because you often hear it said this generation will probably have a portfolio career. They'll jump around a lot. They'll have lots of different jobs. And if you consider the types of roles and the type of activities that happen all the way along the life cycle of a product being developed in pharma, from research and development, manufacturing, quality, pharmacovigilance, regulatory affairs, commercial, sales, marketing. I mean, the opportunities for a diverse career and for a career evolution in pharma are really very, very wide. So I think we also have that, we tick that box in terms of the aspirations of young people too. And, the other thing obviously is, and again, first-hand experience, young people, want to work to live. They don't want to live to work. So, having flexibility in remote working and flexible hours, allowing them to have a better work-life balance, I think, and to travel and see the world, and to have a healthy approach to family life is also really important to them. And in pharma as a sector in general, we're given our sort of our critical mass and our strong employment policies and focus on employees. I think we are a sector that's well set up to kind of meet that need as well. So, and obviously, of course, it goes without saying that young people want a diverse and inclusive workplace, that kind of creates a sense of belonging for everybody, of course. So kind of thinking about all those factors, I see absolutely no reason why we wouldn't have, tons of talented women, young women moving forward into pharma. And industries like tech and energy apparently seem to have less appeal to women. But we have a strong stream of women entering pharma. I think there's a statistic that says, I think about 56% of new entrants to pharma are women. So I think we're bringing them in at the right level, which is really great. of course, that doesn't mean we can be complacent. There's still lots more we can do. And, I think we can do more as an industry at, say, schools and universities to create an understanding of the complete diversity of career opportunities there are across the board. And I think, there still is a relatively weak understanding of the types of roles you can do in pharma. Most people think, oh, it's a white coat, it's a lab job, it's a technical job. And I think that can put a lot of people off. It certainly put me off, I can tell you, because, I did a PhD and I spent 3 years in a lab, and I did not want to work in a lab. But I did want to utilize my experience in the pharma sector. So I had to do a bit of digging around, but I was really pleasantly surprised about the kinds of, the broad kind of roles beyond the lab that exist. So I think we can do more there, to outreach to young people through their channels, through social media and experiential grad programs, to kind of broaden their thinking around what they might, what opportunities they might have in pharma. And I'm sure we'll touch on it again, but this point I've made about we're bringing people in, women in the right measure, but of course we still have a lot to do in terms of elevating women to the higher levels. There's some scary statistics, about workplace in general. I think it's like 34% of SVPs are women, and 28% of C-suite members are women. 28%. Very low, given the talent streams and the diversity needs to be successful. So more to do, I think.
Well, hopefully we do see some change there. But yeah, I love what you were saying around getting in sort of at the education stage as well with universities, and really changing the mindsets around the pharmaceutical industry. It's something that I've spoken with others before about as well. I think obviously people's perceptions of different industries, it can be shaped by the media as well. And of course, the pharmaceutical industry in the media is sometimes portrayed as the big bad, the villain.
For sure.
Yeah, to dramatize things. I think, getting feet on the ground in universities and really showing that pharmaceutical industries, they're more than just people in the lab. They're salespeople, they're patient advocates. Huge tables like this,
right.
really coming together to improve health and the world for all. I think that would be really beneficial.
Absolutely.
Cool. So looking back to those days when you finished your PhD and you entered the lab for those 3 years, if you could go back in time and give yourself some advice when you were starting out in the industry, what do you think it would be?
Looking back in my career, I never had any big grand career plans. And I always felt I should have, what's your 3-year plan? What's your 5-year plan? I really never had one of those. But with hindsight, actually, I think that worked out pretty well for me, because it did mean, I was open to career changes and choices that I probably would never have planned for, because I wouldn't have anticipated or understood what they might be. So my advice with that knowledge now is that I would tell myself to sort of trust the process, be open to change and opportunity, and it will come in unexpected ways. And and as a young woman, I would also say to myself, say yes and then figure out how to do it. Don't overthink it or focus on kind of self-limiting beliefs. And really importantly, speak up, contribute, and be confident, because then, you'll be seen.
Definitely. Oh, I love that. Well, hopefully that reaches some of the younger audience, maybe who may be looking to enter the industry. So we spoke before about moments that led you to become an advocate for women in the industry, and you're clearly a very significant mentor, I could say, in your company. Do you think mentorship has played a significant role in your career?
Absolutely, yes. It's played a crucial role, but I do think, mentoring, coaching, we can tend to overcomplicate the concept, right? In my view, back then, 30 years ago, we weren't using the words of mentor and coaches in the business sense. Although I fully recognize that I had many people across my career who played these roles informally for me, and I naturally gravitated towards people who showed an interest in supporting and developing my career. And there were plenty of people who gave me, stretching assignments and encouraged me to try new things, and were there as a sounding board when I did. And in many cases, these were line managers, but I regard these as mentors, because that's what mentors do, and I have a couple of, I can tell you a couple of anecdotes, or if you like, there's a couple of people that really stand out in my mind that kind of I regard as really clear kind of pivotal mentors in my career. The first one was a general manager, and he persuaded me to make the jump across from medical to commercial. So, as you know, I'm a scientist by training. I joined the industry in sort of drug development and regulatory affairs, and then moved, which was a more natural evolution, into medical affairs. And although I'd sat for many years on, the local operating company management teams, and, with my colleagues was co-leading the business and making collective business decisions in a very participative way, I didn't at all, believe or see myself as having the capabilities to move into a senior commercial role. And he convinced me otherwise. He said, look, you've got strong leadership skills, you've a deep understanding of the business beyond your own kind of area. And I believe you can do it. And I will be here as a sounding board for you because I think it will be brilliant for you and for the company. And honestly, it was his absolute belief in me that was the key factor that made me make that jump. And it was it was a really pivotal jump in my career, actually. And I never regretted it for 1 minute. So he was a superb mentor. I can think of another woman, actually, who I learned an awful lot from. She is to this day a tremendous and, inspirational leader of people and teams. I learned a lot from her about how she set a vision and kind of aligned people behind a common purpose and engaged and energized them towards it. And she was also a really superb networker. And she taught me the importance of networking, both internally to, create your internal capital. That's very important. But also externally, to kind of take you out of your echo chambers that you can sometimes sit in, And one of the things she set up for me was an external peer mentoring experience where I peer mentored with a group of women who are from tech and banking and the public sector and sport. And it was really, really a fabulous experience and a formative experience. So I tell these two examples as kind of the impact that people can have. They may not know they're having it at the time, but they have really a strong impact on my career, and also illustrates what kind of impact support can make. So I in terms of what you could do or advice for women now, seeking mentors, I think, just seek out people who, senior people from whom you think you have something to learn. In my experience, people are always delighted to be asked. It's quite flattering to be asked, and they're always delighted to give time and to give, to give thoughts and opinions to people who are open to learning. So, it doesn't need to be a big formal thing, with forms and, kind of courses. It can be a series of informal chats. But informal though it may be, I would say, own it and drive it, make it happen. And also be open and vulnerable in those discussions, because you will learn the most when you're listening and you're being vulnerable and open around where your challenges are and where you feel your gaps are, because that's when you get the greatest learning experience.
Amazing, thank you. I'm going to be on the hunt for people at my company to be mentored by. I think it's also interesting as well. There's the whole concept of reverse mentoring now as well, where obviously typically you would imagine mentoring being someone who's more senior than you in a position and learning their skills. But then, the younger generation, I think they've got a lot behind them, and it's really encouraging to see as well companies really focusing on that too, and having that sort of
Absolutely.
up and down skill share there.
Oh yeah, peer mentoring is fabulous, and reverse mentoring. I mean, we've just taken 2 young graduates into my team, and it's phenomenal. Even spending time with them, listening to them, understanding their perspectives. It's I think we can learn. There's 360 learning everywhere. Yeah, for sure.
So we've touched on the positives here, but obviously there have to be some negatives as well. Do you think there are some obviously there are some challenges for women to enter the industry, not just in sort of their reticence maybe to enter the field and not being as aware of the STEM pathways, but do you think there are some challenges women face when pursuing leadership roles in the pharmaceutical industry? We've touched on obviously the stark difference between women and men in the C-suite.
Yeah. Definitely. I mean, there are a number of barriers, and the most obvious one may be, that women have traditionally shouldered maybe a disproportionate share of family and caregiving responsibilities, and that's just how it has been. Um, it can be very challenging for career progression in pharma. We're often global experience and being mobile across borders is often required for more senior roles. So that disadvantages women, unfortunately, in moving upwards. Now, what can we do about that? I think we need to change the narrative around parenting, and I can see this happening with younger generations already. The concept of gender neutral parental leave is really important and has been shown to kind of increase the continued participation of women in the workplace and gives mothers and fathers sort of the freedom to thrive both at home and in work by sort of sharing the childcare and the caring responsibilities. And actually, I'm based here in Ireland, and we have a young female minister for justice who has two small children. And I could see her role modeling that fantastically, because she is the first sitting minister to take maternity leave, and she took her full entitlement of maternity leave. But she's married to a leader in pharma, a man who has a senior role, but he was also clear that he was taking the same amount of time under parental leave from his company to kind of co-parent in sequence so that they could both progress their careers. And there was a lot of coverage of it. And I think that kind of role modeling is very important, to try and change that dynamic and that conversation around what it is to be a mother or father. And obviously a second, at Astellas, we try to have to accommodate. We have a lot of flexible working policies that kind of try to tap into that need, so that women are not really forced to choose between a career or a home life, and that they can try and balance those things as equally as possible. And obviously, like, company policies are one thing, but I think the cultural attitude around what it means to be a mother or father is a longer term change that needs to evolve. I think that will drive benefit for all. So I think that family caregiving responsibility is a really important one that has to date sort of held women back. But I think there are many moves afoot to kind of change and enable a better situation there. The other thing I think about is that statistic around the broken rung, as they call it. So we've talked about that women are entering pharma in equal numbers to men. That's not a barrier. But we know that that first point of promotion is a really important landmark. So the first point of promotion to a manager role is a very important landmark in a career. And for every 100 men promoted to manager, only 87 women in pharma are promoted to manager at the very first step. So that's a challenge, because it starts early and then that kind of propagates across the course of a career. And it's, what can we do to help it? I think we just need to name it. I think companies need to be very transparent about gender representation at senior levels, and they need to make clear their intent and their commitments to do something about it, and be kind of accountable for it at a corporate level. At Astellas, we're doing a lot of work here. We have in the region I work in, which is Europe and Canada, we have a DEI policy that is trying to kind of increase female representation in areas of the workplace in pharma that they're often underrepresented in. And also we have a big focus on trying to increase the numbers of women in leadership roles. And one nice thing that I'm proud of is that the leadership team that I sit on for the established markets is made up of 11 women and 6 men. So we're doing well. It's fantastic. The diversity is important, but we can't be complacent. And another thing that I think is important is that we're doing is sort of being very proactive around succession planning and talent development. So we have a situation whereby our succession planning requires us to have a minimum of 1 woman in the Ready Now succession plan for every senior role in the company, VP and above. So I think, these requirements will help because they foster things behind that enables that to happen.
Yeah. Oh, that's amazing to see. It's great that you guys are sort of acting as a really stellar example, stellar and Astellas, a stellar example there of what companies should be aspiring to. That's amazing. And yeah, seeing that those progression plans are actually in place and there is quantifiable like examples of how it can happen. I think that's really good, and hopefully something that other companies are employing as well.
Hopefully. Yeah.
So this draws me into our final question of the interview. Thank you so much for staying with me so far. Looking very much towards the future, what is your vision for the future of women in pharma and STEM? And what steps can the industry and the world at large, I think we've touched on this a lot, but if you could sort of summarize it all, how can we make this a reality for more equal footing for women in pharma?
I mean, my vision, I would hope and expect that the pharmaceutical industry will attract the best and the brightest women and men in equal measure, and that they will progress and promote them equally based on merit. We absolutely need this because, in pharma, we still have so much to do in underserved areas of healthcare, including rare diseases, Alzheimer's, motor neuron disease, mental health. Patients are waiting for these treatments to come. And in my view, there's absolutely no doubt that women will play an invaluable role in developing and implementing these medicines and implementing these healthcare solutions. Because as we touched on earlier, like in any industry, building a gender balance in the pharma workplace brings an important diversity of approach and perspective to innovation that will really help drive progress. And, we'll all be patients one day, and the scientific community will really continue to depend on the equal contributions of women to advance medical breakthroughs and improve people's health. So, that's my vision and my hope and my aspiration. I'm also realistic. True gender balance won't happen overnight. It will require a change in culture, so that we're really evaluating individuals on the basis of their talent, investing in that talent, removing barriers for them, and ensuring that we're getting the right people into the right positions. And tackling the barriers is one thing, we can all set targets and put policies in place, and that does focus the mind and create a conversation around it. But I think the thing that's going to be the real game changer to kind of permanently dismantle the barriers that exist will be investing not just in how to instigate the change, but how to sustain it over time. So I know there's a wave of bright and talented young people, men and women, coming behind that will be both leading that change and being key allies for it, and hope we'll move it along.
Absolutely. Well, hopefully, we can sustain that change. Thank you so much for taking the time to talk to me today, Martina. It's been amazing talking to you.
Thank you very much, Jade. I've really enjoyed it too.
Well, I really enjoyed that. I really hope that the pharma industry will indeed attract the best and the brightest, as Martina said there, in equal measure in the future.
Yeah, absolutely. But clearly there is still a lot of work to be done in the industry. I found it quite shocking, especially that there's still such a gender gap at the top of the chain. There are still so few women working at that C-suite level, as Martina mentioned. But hopefully, as more women do enter the industry, we can see some change trickle down from that top level and really see some change there.
Yeah, absolutely. And Martina's definitely not the first woman in pharma to talk to us about this issue. We've had a number of people on the podcast share similar views. So yeah, really important issue to raise awareness of. A thing that I found really interesting was the gender-neutral parental policy she was talking about. Progressing in pharma can be really difficult. It often requires travelling across borders. So yeah, I think having more agility, is obviously helpful to getting promoted. So yeah, it's better we balance out those policies.
Absolutely, yeah. Changing the narrative around parental leave and helping both women and men stay in the workplace for the best amount of time that suits their family individually would really help to make that journey to leadership a lot easier, and it's something that really progresses past the industry itself too. True,
something for all industries to think about, I think. But that does bring us to the end of today's episode. Thank you so much for joining us. Thank you, Jade, as ever.
Thank you.
Be sure to join us next week for another insightful episode, we hope. But until then, it's bye from us.
See you next time.